If you have something wrong with your Eustachian tube, you probably had an appointment where your doctor said it's incurable. Bye. And if that happens to you, this whole image of medicine that Hollywood and TV has brought up, where the doctor never gives up and they always figure out what's wrong with the patient, you realise very quickly that's total nonsense, and most doctors will just run away at the first hurdle. I've had Eustachian tube problems, that's the ear pressure tube between your ear and the back of your throat, for about 14 years now. It tortures me daily. I know why I have Eustachian tube problems, and I wanted to talk about why the situation is so catastrophically bad. I think the first big issue comes with the classification. Eustachian tube dysfunction or disorder. Everything and anything that could be wrong with the Eustachian tube is classed as the same condition, which completely screws over the patients and makes the science practically impossible. If the doctors aren't trying to figure out what is wrong or trying to subcategorize people, then the situation will never improve. I think the way that the body is compartmentalized and that the ear, nose and throat fall under the same doctors is a terrible way to do things. The Eustachian tubes are considerably different, considerably unique, that they should really have their own specialization. But that doesn't happen. It gets lumped in with ear, nose and throat. And the ENT doctors that I've met, they've largely been surgeons. You know, their job is to cut people up and stick them, sew them back together again. Dealing with problems with pressure and, the movement of air, which is fluid dynamics, that's a completely different realm, and, frankly, that's a completely different academic ability to what most of these doctors have. And if the body is just going to be split up into this doctor is this part of the body, this doctor is that part of the body, rather than based on potential physical concepts of what can be wrong, it's a complete scientific black hole. On top of being compartmentalized, it's also just assumed that this doctor for this part of the body does the diagnosing, does the procedures, does the follow-ups and does the research. And those are completely different skills as well, which frankly a lot of them don't have. My Eustachian tube problems started about 14 years ago. I started getting this pressure and this banging in my ear, just randomly. And this got worse and worse over several years. And on top of that, I had jaw problems as well. I had been to, all kinds of doctors. They had they'd looked in my ear, put the scope in the ear, have a look at that end of the Eustachian tube. I had endoscopes up my nose to look at this end of the Eustachian tube, and they hadn't found anything wrong. But, anything along the length of the Eustachian tube or anything pressing upon it is just completely, their concept doesn't exist to the doctors. So it's completely ignored. And it's a very long story, but I eventually realised that my problem was the fit of my teeth. The way that your teeth fit can push your jaw from side to side, and the Eustachian tube is next to your jaw. So problems with the jaw muscles can push or pull on the Eustachian tube. After several years of worsening Eustachian tube problems, and my life was pretty much hell. I was unable to work, unable to sleep, unable to think properly. I eventually stumbled across a dentist with an interest in jaw problems. And by having a splint made that changed the contact surface of my teeth, the moment the first change happened, I realised, oh, right, my Eustachian tube problems are because of my teeth. This contact surface of my teeth is messing with the muscles that control Eustachian tube, and that's what's causing the spasms that are making my ear bang. Of course, I was overjoyed at first for finding out what was wrong, but little did I know my problems had just started, because that is a crazy and unregulated world. Dentists and orthodontists and jaw problems, that is one hell of an issue that is widely kept out of the public eye. The splint that the dentist made, it worked until he then messed it up and of course blamed me for no reason. The orthodontist I then went to messed up my teeth worse, and made my symptoms worse when they should have fixed me. So I was left with, even worse, far worse jaw pain and worse Eustachian tube problems, and I've actually been wearing an earplug because of it's the only thing that can slightly limit the banging in my head. There's an old condition called exploding head syndrome, which I suspect was Eustachian tube disorders, classified as something a bit more exciting sounding. If someone felt like their head was exploding, there's probably pressure changes in their ear. But I digress. Since the orthodontist messed me up worse, I've been going around the houses trying to get treatment. It has been hell. I have essentially been left with teeth that don't fit, horrible jaw problems, Eustachian tube problems, tinnitus, all because of the same cause. And of course the doctors don't believe me, because they've decided Eustachian tube dysfunction is incurable, and that's the way it is. And that's my real issue. I can't expect doctors to know everything. I can expect them not to be so bloody ignorant. I mean, at first when I figured out what was wrong, I was quite naive, and I thought my doctor might be interested to hear a potential cause of some of their patients' Eustachian tube problems. No, laughed in my face. Of course, they laughed in my face. It's their part of the body, and if they don't figure out what's wrong, nobody can. If there's not a randomized controlled trial, then it doesn't exist. And that's a big problem in healthcare. So hopefully, this video will be of some comfort to Eustachian tube sufferers. You're not alone. It's a living hell, depending on how messed up you are. The doctors are generally pretty awful. A lot of them are into healthcare because they like playing the hero, and when they're not, they can be rather blunt and just want you to go away, which is what seems to be happening with the Eustachian tube problems. And some of you will have problems with Eustachian tube because of your teeth, and you're not getting diagnosed, and you're not going to, because there's widespread denial amongst dentists and orthodontists regarding the teeth. The senior figures know very well that they can cause problems in the first place with your jaw and your ears, but they stay quiet about it because it's a cosmetics industry. But again, the term Eustachian tube disorder, dysfunction, covers anything and everything wrong with the Eustachian tube. And with no subcategories, things aren't getting better. I'm beyond sick of suffering, knowing what's wrong, knowing what's fixable, so I've decided to make videos talking about it. I don't know whether people will listen or not. I hope it helps you. We are on the bad side of healthcare, and we have to fight for ourselves, so, good luck. Good luck.